What's up, ladies and gentlemen? Welcome back to Neurosketch Videos again. Welcome to Zima moto series, and today we're going to discuss the histology of the GIT, gastrointestinal tract. Now, the GIT wall has got four important layers, which are also called tunics, and from inside we have the mucosa, followed by submucosa, followed by muscularis externa, or the muscular layer, and followed by the serosa, which is the outermost covering. Now, the innermost covering we said is called the mucosa, and the mucosa has got three important structures or three important components. And the first one is called the epithelium, followed by the lamina propria and the muscularis mucosa. The mucosa is the one which is accounting for regional variations of the structures of the gastrointestinal tract. Whenever you have differences, mainly are going to be accounted by the mucosa, which is the innermost layer. Next, you have the submucosa, and what is so important in submucosa here, we have a plexus of nerve connection, which is called the Mason's plexus. The Mason's plexus, also called the submucosal plexus, because they are found in submucosa. And these plexus of nerve is the one which is responsible for secretions in the GIT. So whenever we need the secretions, these nervous plexus are going to bring the nerve information to supply to code for this secretion. And where the location of the Mason's plexus, they're found in submucosa. This is why they're called the submucosal plexus. And then next we have the muscular layer, which is called the muscularis externa. And the muscularis externa has got two important muscles which are arranged in two fashions. The inner one is called the inner circular muscle, and also have the outer one, which is called the outer longitudinal muscle of the muscularis externa. Now, between the two layers, between the innermost and the outer, inner and the outer layers of this muscularis externa, we have a plexus of nerve, and this plexus of nerve is called the mesenteric plexus, which is also called the plexus of Auerbach. So it's the Auerbach plexus or mesenteric plexus of Auerbach. Where is it found? Between the inner circular and the outer longitudinal. So within these two muscles, what the function of this Auerbach plexus is for peristalsis, for contraction and relaxation of the tubes of the gastrointestinal tract to make sure that the food is moving. So it's a parasympathetic in nature. And what do you think it comes from? From the vagus nerve. Yes. So that's your mesenteric plexus. So it's very, very important. The mesenteric plexus is found between the muscularis between the inner circular and the outer longitudinal, but the Mason's plexus is found in submucosa. Okay, the submucosa. And last, you have your covering, which is called the serosa. So we're going to see partly we have esophagus, and what is the epithelial lining in the esophagus. This is worth noting is stratified squamous and non-keratinized, or non-keratinized stratified squamous epithelium is covered in the bigger part of the esophagus. And the lower part of the esophagus is actually transitional. So you are coming from the esophagus going to the stomach. You have a transition in epithelium. You have a change in epithelium, and there is you have your columna. So we have transition zone in which we are changing from the squamous epithelium to columnar epithelium. Let me take you back to the oral cavity. So within the oral cavity, we also have stratified squamous epithelium, which is non-keratinized. So we have non-keratinized stratified squamous epithelium from the oral cavity, also going to the esophageal mucosa, which is also lined by the stratified squamous epithelium, non-keratinized. But the lower part of this trachea, the lower part of the esophagus, is actually the transition. Okay, that's transition. Next, you're going to the stomach, and the stomach is lined by simple columnar epithelium. So columnar epithelium, this is why we have a transition from the squamous epithelium in the esophagus going to the columnar epithelium within the stomach. And this is because you know the function of the stomach. Next, you have the intestine, and the intestine also formed by simple columnar epithelium, and this is for absorption purpose, a simple columnar, which is for absorption. And then we have a layer of lymphatic, organs or tissue within the intestine, which are called the Peyer's patches. That one you remember. Last, you have the anal canal. And what's so important about the anal canal is that the lower part of the anal canal is actually keratinized squamous epithelium, the same as the one which is covering your skin. So that's the keratinized squamous epithelium. But on the upper part of the anus, we have the non-keratinized squamous epithelium. So we have two epithelia here. The upper part is non-keratinized, the lower part is keratinized, the same as the skin. But the upper part, the upper part here of the, as you are moving away from the anal canal going to the rectum, you have columnar epithelium, which is also transition. Okay, this is what I had for you.